ಇವಾಗ ಹೆಂಗ್ ಕಾಣಿಸ್ತೀನಿ.
Namaste, a very good evening to everyone. A nice, beautiful evening also, and a wonderful day to remember. Today is World Health Day, 7th of April, and every year we bring forth different other knowledge-based series so that we are able to reach the society with more and more information. So I'm Dr. Vasudha Sharma, Director of Medical Services of the chain of integrative medicine-based centers, Vivekananda Health Global. We are now hosting this from Bangalore. So it's my privilege to have Dr. Karunesh Kumar today, because we are going to talk on the topic of lifestyle, which is a very, very important segment for management of diabetes. And Dr. Karunesh Kumar is an established diabetologist, of course, a general physician, and he represents, or he has established, Diabetes Medical Center situated in Kormangla in Bangalore, which is a state-of-art facility for diabetes care. And he is not only working across different streams in diabetology, but specifically focuses on diet, podiatry, and of course, diabetic nursing, and definitely is here because he believes in education, educating the masses rather. So it's a privilege to have you, Dr. Karunesh Kumar, today, and
thank you very much
so much for your time.
Thank you very much, madam. Good evening to everybody. So as it is mentioned, World Health Day is a very, very important day. So today the topic is also very good, the lifestyle management of the diabetes. So I thank Dr. Vasudha for making this interesting topic on this day. Please.
Thank you, sir. So, of course, we are all here to understand more about the management, and especially why lifestyle has become so important. Everybody talks about lifestyle intervention as one major category. But first of all, before we really get into the understanding of the particular aspect, I would want you to throw some light on this aspect of prevalence of diabetes, because we see that diabetes has become extremely prevalent in the society in India and in the world. And why do you first of all think that diabetes is so prevalent?
Yeah, diabetes being a lifestyle disease, especially now type 2 diabetes, what we are talking commonly. So type 2 diabetes is a lifestyle disease. We already mentioned. It is because of the unhealthy lifestyle or the poor lifestyle, I can say. So the modern day living is very, very stressful. People are in hurry, a lot of physical and mental stress, too much of work, pressure, targets, and sedentary lifestyle. These are the main factors which are causing the diabetes. So one famous saying is, hurry, worry, curry. These are the three things in a simple way we can say. So people are in hurry, morning to night, people are working, both husband and wife are working in Bangalore, most of the cities if you see. So then lot of worries and very bad curry. So hurry, worry, curry is the triangle we say. So this is giving rise to the lifestyle problem. Diabetes, if I say in simple words, some 40-50 years back, people used to think diabetes means high sugars. Even now people say high blood sugar or blood sugar complaint, sugar complaint. But as the research has progressed, we know that it is just a tip of the iceberg. High blood sugars is only the manifestation. There are hundreds of mechanisms happening inside the body. So there is a deep iceberg below the tip of the iceberg. So it is a metabolic disorder. It is not just high blood sugars. It is not just carbohydrate metabolism. There is a deranged protein metabolism, lipid metabolism, deranged vascular endothelium. That is, the fat metabolism is also changed. So many aspects for this. All these things totally result into diabetes. So the major factor for the diabetes, type 2 diabetes, is the insulin resistance and metabolic syndrome, we say. So insulin resistance is, all of you know that deficiency of insulin is the cause of diabetes. Most of the people think like that. That is one aspect. The beta cells in the pancreas are secreting less insulin. So that is resulting into diabetes. But this is only one dimension of the diabetes. More important is the insulin resistance. That is, in the insulin, whatever secreted from the beta cells becomes ineffective. That is, a relative deficiency of insulin is there. Why there is relative deficiency? There is lot resistance offered by the person's body because of the fat accumulation. Excessive fat accumulation in the liver, pancreas, everywhere results into resistance to the action of insulin. So obesity results into fatty liver, fatty pancreas, and excess fat deposition, which results into ineffective action of the insulin. So sugars goes up. So this is the main thing. So lifestyle leads to this. Poor lifestyle, poor eating habits, sedentary lifestyle, excessive stress leads to this insulin resistance. So the beta cells get exhausted. When there is a resistance, beta cells have to secrete more and more insulin. So unnecessarily more and more insulin is secreted. That is the problem.
So very well said. I think this hari vari kari, people should remember. And I think we can also see a lot of people responding to the treatment as well. But though you overall mentioned, we see that India is also the diabetic capital of the world now. So is there any other specific problem, or predisposition which we see in Indians, due to which India is probably, in this zone of being the diabetic capital of the world? So what is your opinion, Doctor?
Now we say that India is the capital of diabetes, especially Bangalore is also capital of diabetes, as well as the IT and BT city. So there are some lot of research has happened. Like when I remember in my childhood, when I remember my grandparents, they were very healthy. My grandfather died at the age of 92 years. He never had diabetes. So in my childhood, I remember they used to call diabetes as people of disease of rich people. We could name. I come from a taluk place, and they used to, people used to say, this person has diabetes, that person has diabetes, like that. Now we can't count it. Every alternate house or 1 in 3 houses are having definite diabetes. So what has changed in this 50 years, if we see, or 100 years? This is known as thrifty gene hypothesis. Thrifty gene. What is thrifty? THRIFTY, thrifty. Thrifty is a wise management of money or any resources. That is thrifty. A person is said to be thrifty when he is able to manage his resources very wisely. So this is thrifty genes. So some genes have become very thrifty. So we are getting diabetes. So you are surprised. What is this paradox? We are telling wise management and getting into diabetes. So India, some of the races, they have seen that we are more prone to diabetes. That is Indians, Southeast Asians, Bangladesh, Pakistan, Indians, Sri Lankans, all this Philippines, Koreans, even including Japanese, Chinese, we have very high diabetes incidence. So compared to Caucasians, that is the Europeans and Americans, compared to Americans and Caucasians, Europeans, we have very high incidence of diabetes, high prevalence of diabetes, very early age, onset of diabetes is very early age, and very high incidence of cardiovascular diseases, very high heart attacks at very young age. And when you do angiograms, the blockage is very, very high in Indians compared to the Caucasians. So now what is this thrifty gene hypothesis? There were a lot of famines. If you take the last 3 centuries or 10 centuries, every 20, 30 years, we used to get a famine. That is not in after 1900, before the independence, if you see. After independence, because of the Green Revolution and so many advancements in the technology and agriculture, we don't have seen any famine now. Okay. So the evolution theory, according to the evolution theory, whenever there is a famine, the body gets adjusted to that circumstance, that situation. So that is the survival of the fittest. There will be some changes in the bodies. So whenever there was repeated famines, or in each famine, the body gets adjusted to that and starts storing the surplus food into fat in the body. So the fatty liver, the central adiposity, the typical bellies of the Indians, is a defensive mechanism or a thrifty mechanism, wise mechanism, this to store the extra calories and keep it as a fixed deposit. And after 10 or 20 years, when a famine comes, then that fat is used as calories, released as calories. So this was a wise mechanism or a thrifty mechanism during the famines. But the same wise mechanism, there are no famines in the last 100 years, but the body, the genes are used to store the excess calories as fat, fatty liver, and central adiposity, visceral adiposity. So that results into excessive diabetes. That is why we are having this high preponderance for the diabetes, number one. Number two, you can see that the socio-economic state, especially the economic state, is improving in the last 100 years, if you see. And all this research is resulted into sedentary lifestyle. So earlier, my grandfather time or my father's time, they used to walk to get some groceries from a nearby shop, or to go to a nearby school or something. People used to walk 50 years back. Now everybody wants a two-wheeler or a four-wheeler for even to go for a furlong. So there is no lack of exercise in the day-to-day activities, and dedicated exercise behavior also very less. So, and rich food intake has become a common. If you take 100 years back or 50 years back, people used to eat more sweets or rich food only on occasions of festivals or some special occasions. Now, especially after this Swiggy and all this door delivery has come, people just sit and order. It has become, there is a lot of research studies how Swiggy or all this Zomato has made people to order more. So they eat more rich food and result into high calorie consumption. And especially we have seen all these things with our own eyes, no need of any big research papers. I think all of you will accept that most of the people, 80% of the people have gained weight in this last 2 years because of the lockdown. Due to the COVID, because of the lockdowns and work from home, most of the people, 80% people have gained weight, 2 to 5 kgs up to 10 kgs. So naturally, most of my patients, if I observe, they have gained weight and sugar levels have gone up, HbA1c has gone up. So this is a practical example in these 2 years that sedentary lifestyle, excessive work stress, and eating high calorie diet is the main culprit or the mechanism to cause more metabolic diseases, especially diabetes, high cholesterol, heart diseases.
I think a very valid point, doctor. And I think the history which you mentioned is also very interesting about the famine and the belly fat and the accumulation of fat, as you said, as a reserve. But now, and also the other part now in COVID, like you said, people who have already had diabetes have seen a lot of changes rather on the negative side. Similarly, we have also seen a lot of pre-diabetic conditions. So even when I have acquainted this in the clinic, they come with 7+. Many of them have come with 7+ HbA1c. So, but we should be able to basically tell people what is pre-diabetes and why do you think it's very essential for people to control it at this phase rather than allowing it to uh, get into the next phase of qualifying itself to become type 2 diabetes.
Yes, this is very, very important. So pre-diabetes, if we can diagnose at the stage of pre-diabetes, we can prevent stepping into diabetes. This is very valid point. In simple words, fasting blood sugar more than 126 is diabetes, but fasting sugar below 100 is normal. So between 100 and 126 is borderline diabetes or pre-diabetes. In the same way, postprandial sugars more than 200 is diabetes. Postprandial sugars below 140 is normal. Between 140 to 200 is borderline or pre-diabetes. And HbA1c, I think all of you will be knowing, that is the 3 months average value of blood sugars. So normal is below 5.7, above 6.5 is diabetes. So between 5.7 to 6.5 is pre-diabetes. So a pre-diabetes is like a borderline diabetes. He is not healthy, he is not diabetic. So he is having some deranged metabolism, he is in that borderline stage. Within, suppose if he doesn't take proper action at this stage, if he doesn't do good exercise, if he doesn't decrease, go for healthy diet, then he will go into diabetes very fast, maybe within 3-4 years. So that's why this pre-diabetes is very, very important. So when people go for regular health checkups, then we detect many times pre-diabetes. And when we emphasize about the diet, exercise, there is a lot of people are benefited. They can pull on for 10 to 15 years in the pre-diabetes stage, or they can reverse the diabetes. This is the new concept. Since 2 years, I am doing the diabetes reversal program. Nearly 250 people I have done, and 80% success rate I have seen. So I'm able to reduce for the established diabetic patients, reduce the number of tablets they are taking or reduce the insulin dose they are taking. Even I am able to stop the insulin for many patients. So this is the advantage of the lifestyle modification, that is the diet and exercise.
Yeah, very great achievement, Doctor. I should say that you are working so well on reversal, because many times we find some of the patients saying that if you go to some places, not of course pointing at anybody, but certain hospitals, we find that they just want us to take medication. We are pushed more towards that, less towards different other aspects. But I think this is the way forward, and this is the future for healthy India, and that is what we look forward to. And many of them, therefore, have to understand the preventive strategies, as you've been mentioning. But we hear many also questioning. Now, if my father or mother was diabetic, or both of them say are diabetic, can somebody make a definitive statement that, okay, no, I am also going to get it? Rather, they feel that the son or daughter is also going to get it. And this, I think, is definitely taboo, which is there in the society. And people have to get over this.
This is very good question. So what the research shows is, if parents are diabetic, the risk for diabetes development in children is very high. If one parent is diabetic, we can say 30% higher risk for the children to develop diabetes. If both parents are diabetic, nearly 60% risk of developing diabetes. So it is not 100%. So if somebody follows good lifestyle, good diet and exercise patterns, definitely they can escape from developing diabetes. I think now this question is because most of the families, there are only one or two children. So, or three probably, if we take at my age, people of my age. So suppose if my parents are diabetic, only if you see two or three children, the chances of diabetes is more. If you see like earlier generations, like 6 or 8 children, if I see my father's brothers and this thing, so only like my father's siblings are 8 people, only 2 are diabetic, 6 are not diabetic. So if we see like that, I think we can say that 100% there is no chance of becoming diabetes.
I think this will give a lot of confidence to people because this is at most needed, for them to also understand that by default I'm not going to become a diabetic. So a very very positive note from your end. So therefore, now as we start to reveal more or understanding more about the management and preventive methodologies, what are the primary lifestyle changes which you recommend for people with a strong heredity factor? Maybe just top 3 points, doctor, though we have been elaborately discussing.
So lifestyle modification, first thing is exercise, second thing is the diet. So very, very important. Coming to top 3 is sugar is the new enemy. We should think like that. So reduce the sugar consumption. That is the most important. Especially like now the problem with most of the hotels is this buffet system. That is the problem. When you go for a hotel or a marriage, when you order a la carte, you will order what you want and you eat out and come. But when you go for a hotel where buffet is there, they serve so many items, and because you have paid the money, there is a human tendency to eat, consume more. And after finishing so many starters and main course in the buffet, there will be dessert section. So there will be at least 5 to 10 desserts. So this is the problem. When going to hotel, you have to choose. The best advice is go for a la carte, not for the buffet.
Yeah, since we're talking about food, and I think on a lighter note, but on a serious note now, what is that you recommend in food, which people can add on a daily basis to maintain their blood sugar levels in case they're diabetics and in case they're not diabetic also, both ways?
Yeah. For diabetics, we best is low carbohydrate. Actually, what a diabetic follows, same thing if a person who is healthy also follows, definitely he will not have the chances of getting diabetes or progression to diabetes. But because it is little boring to completely avoid sugars, so we can say that whatever I describe for a diabetic diet now, same can be followed by even the healthy people to 50 to 70% extent. That is the easy way to say. So a diabetic diet should be mainly low carb diet. So carbohydrate should be less. The problem with our Indian diet is we are high carbohydrate consuming people. Our carbohydrate levels are very high. So this is seen with all the Southeast Asian countries, including the China, India, Pakistan, Bangladesh, up to Japan. We are rice eaters and lot of carbohydrate consumption is there. The basic concept of diabetes diet, I'll explain in 2 examples. One is diabetic plate or healthy plate. So when you see your plate, you have to divide it into 4 quarters. So 25% of your plate by volume should be carbohydrate. That's all. That is 1 quarter, 1 quadrant of your plate should be carbohydrate. 1 quadrant or the another quarter should be salads. Another quarter boiled vegetables or the palya. The another quarter or the quadrant should be protein. So 1/4 or 1/4 carbs, 1/4 protein, 1/4 raw vegetables or the salads, 1/4 palya or the sabji, boiled vegetables. So if you do like this, definitely the number of calories we are eating will come down, the fiber food will increase, the protein will increase. The main problem with Indian diet is 60% of our diet is carbohydrate, even 60 to 80%. That's why, especially after breakfast, the sugars are very high. If you see, if anybody of diabetics are checking in the practice of the glucometer, we tell to check whenever a person comes with very high blood sugars. I tell them to check 2 hours after breakfast, 2 hours after lunch, 2 hours after dinner. So 2 hours after lunch and 2 hours after dinner many times is better than 2 hours after breakfast, because our breakfast is very high carbohydrate. Especially if some people eat kara dose, kara roti, akki roti they make, kara roti, and kara dose, kara idli. When you take an example of kara dosa, what is there? Nothing, just dosa and chutney. There is no salad, there is no sambar, there is no palya. So it is very high carbohydrate. Suppose if you eat idli and sambar, you will eat 3 or 4 idli plus sambar. If you eat idli and chutney, you will eat 1 more idli, because the chutney is not filling your stomach, whereas sambar and vegetables will fill your stomach. So you will eat 1 idli less. So when you eat more carbohydrate, you will not naturally will consume more carbohydrate. In the sense, idli, dosa. So never eat the kara roti, kara chapati, and all these things. So always make dosa and so as I told in the example. So coming to examples now, that plate I told, diabetic plate. So 2 dosa with 1 cup of salad, 1 cup of sambar or 2 cups of sambar. That is the best way. Okay. So when you eat only chutney, you will eat 3 dosas. You can just you can see from your experience. So compared to chutney, sambar is better. Dosa and sambar, idli and sambar is better because there is lot of vegetables, lot of protein. Dal, you are putting dal. In chutney, there is only coconut or a little bit of groundnut. That's all. So this is one simple. So my advice is simple modifications. So whatever you are eating, just see your plate. Am I eating more protein? 25% protein is there. If not there, put more grams, more sprouts, more dal. Okay. Then am I eating more vegetables? 50% of my plate is vegetables. So eat more salads and more sambar palya. So eat less carbohydrates. So all these are carbohydrates: rice, chapati, dosa, idli, mudde, that is ragi ball. All these are carbohydrates. So reduce all this. Some people are in the false notion that ragi ball is not, carbohydrate. They think we eat ragi and so we don't get diabetes. But you can see a lot of farmers and villagers are getting diabetes. The diabetes incidence is increasing even in the villages. Even in the working class, labor class, they are also getting a lot of diabetes. Maid servants are getting diabetes. So why is this? When they are eating ragi, why they are getting diabetes? Actually speaking, the glycemic index of ragi is more than the glycemic index of rice. The glycemic index of wheat is 65 to 67. Glycemic index of rice is 73. Glycemic index of ragi is 83. So that's why, in nutshell, one more example is 1 cup rice, 1 cup sambar, 1 cup palya, 1 cup salad. So 1 cup rice, 1 cup salad, 1 cup palya, 1 cup sambar. So the quantity of rice, idli, dosa, mudde, all these things should come down. That is in nutshell. The quantity of vegetables and protein should increase. Okay. So our Indian food is very high carbohydrate, high fat, and low protein and low fiber. We have to reverse this into low carb and low fat, and increase to high protein and high fiber. So this is the main in essence. And also I teach people to classify food into red, orange, and green. So like traffic signals, when you go in a traffic, when you get a traffic signal, if red light comes, you stop. If orange, yellow light comes, you get prepared to move. If green light comes, you will start moving. In the same way, so red signal, what is red food? So sugar, sweets, chocolates, then fried chicken, fried bonda, samosa, so bread, maida bread, then maida, this one, roti, all these things comes to red foods. Then orange foods are medium, like suppose if you take the example of non-veg, suppose if you take the example of chicken, so the chicken kebab, chicken fried, all these comes to red food, whereas chicken curry comes to the orange or green if you prepare with less oil. Barbecue chicken, grilled chicken will come to the green. In the same way, if you take egg, if egg curry with lot of oil will come to red, whereas just the egg white comes to the green. In the same way, if you take fish curry or boiled fish comes to green, whereas fish fry comes to red. So like this, the same preparation you can make into red, green, or orange. So if you take salad with mayonnaise, it will become red food because mayonnaise is very rich in fat. So if you take just salad, it becomes green. So each food you have to think, is it red, orange, or green? So eat more green and avoid the red food. So this is known as flagging of food. Red flag, orange flag, green flag. And so if you just adopt these two things, no need of lot of mathematics, science and all. So is it orange food, red food, orange food, green food, or the quarters I told? Carbohydrate 1 cup, vegetables 2 cups, and protein 1 cup. These simple things you should adopt in your diet. Then it will be a very healthy diet. Same thing should be applied even for people without diabetes, healthy people. So to some extent, maybe 60-70% extent.
I think very elaborately explained, Doctor, and then very easy. I think people will find it very easy to understand. Just you're talking about is the 4 parts of a plate and the 3 lights. So they are the most important things which people should also remember. But since we're talking about food, people also are slightly confused. Sometimes they say, I'm following a healthy lifestyle, but they go and land up taking processed food, or sometimes, all Chinese food and different spaghetti to whatever is made up of maida or different other paste. And they might feel that they're taking juice, but they will be taking it in the Tetra Pak. So I think a lot of education also has to go into this, because when it says juice, it has to be fresh. So how do you, kind of tackle these aspects in your clinical practice?
Yes. So very pertinent question. So juice with sugar is not at all good. So you can take the juice like whatever you take, like watermelon juice and all these things. Try to avoid sugar in that. Or if you want little sweetness, you can go for stevia or sucralose in the juice also, but not the uh, aspartame, because aspartame, if you use, that can cause cancer on long-term basis. So stevia is best. Stevia is a plant product, so you can use the stevia in the juices also. That is way. Or whenever possible, you can. If a person is not diabetic, he can add little sugar instead of the, because when you go to juice centers and hotels, they pour so much of sugar to make it tasty. So that is dangerous. Then coming to all packet things are also with a lot of preservatives and lot of sugar. So that is also not good to use the preservatives. So
yeah, so I think now a lot of information has been shared about food, and the next major or the crucial element is also what we do, in terms of exercise. It could be walking, it could be yoga, there are different forms of exercises too. So what is the baseline recommendation when somebody has to say, I need to have X duration of physical activity for myself?
Yes. So exercise is the most important part of the health to prevent the diabetes or heart diseases or to decrease the cholesterol for a healthy being. The recommended exercise is at least 30 minutes of exercise or walking per day for 5 days a week. This is the minimum recommendation. But for Indians, that is, I told we are at high risk of all these things. So all the 7 days a week, that is what recommended, 30 minutes. But in my experience, this is the guidelines. But in my experience, just 30 minutes of exercise is not adequate. At least 1 hour is better. So if you want to take a break, at least once a week is okay. On a Sunday, if you want to take a break. So 5 to 6 days a week is best, 1 hour daily. And coming to exercise, both isotonic, isometric should be included. Only walking, that is cardio. See, walking, treadmill, these are all cardio. So only if you do cardio, it is very good for your heart. It burns calories. You feel fresh. That is all good. But the muscles are not fully activated. Metabolism in the muscles are not 100% utilized if you do only walking. So a combination of walking plus the slight weights or the resistance exercise, what we call. What are the resistance exercise? So using slight weights like maybe 5 kg, 10 kg, not to go for 20, 30 kgs. No need to go to gym and all. If you want to, if you are a fitness freak, if you like gym, if your age is okay, you go to gym, that is fine. But I am talking about a general diabetic who is 40 to 60, 70 years of age, who wants to maintain good health, then just doing in your house also okay. So 30 minutes of walking plus 30 minutes of exercise in the house is okay. So coming to about walking and jogging. Jogging is not much recommended. If you are in the habit of jogging, it is okay. But brisk walking is better than jogging, because we are seeing that a lot of heart attacks are happening, sudden cardiac deaths we call during jogging. So after seeing the sudden cardiac deaths, especially our recent unfortunate experience of our film actor Puneet Rajkumar, or many of the football players and other in the international examples also. So too much of exercise is also not good, especially jogging and all is also not necessary. Maybe good with proper evaluation of echo, treadmill and all. If you do jogging, it is good. But for an average diabetic, 30 minutes of walking and 30 minutes of exercise. Coming to exercise, I was giving one example of weights, small weights. The other resistance exercise is doing abdominal exercises. That is very good. But the best exercise to do inside the house is Surya Namaskara, I feel. Because if you do 20 rounds of Surya Namaskara, it gives exercise from head to toe. All your body parts are covered, all the muscles are covered. So if somebody wants good burning of calories, Surya Namaskara is the best exercise. If you do 20 rounds, you will be sweating and all your muscles and parts of the body are covered in the Surya Namaskara.
Yeah. So we have also seen that very, regularly in practice, where we give yoga therapy to patients, because yoga therapy is like one module which has different yoga practices, and which of course includes Surya Namaskara. And sometimes there's a contraindication for Surya Namaskara, or if people are not able to do, we have modified versions such as chair Surya Namaskara. But yes, yoga has really proven to be a very great intervention in in the management and prevention of diabetes. And I know that you are a very strong believer and practitioner of yoga, and I think that assertiveness coming from you will also help people understand why it's so beneficial. And based on your recommendation, a combination of walking with yoga is also, definitely will work wonders for people in their day-to-day activities, and therefore in management of diabetes also. So any other specific recommendations when it comes to sleep? Because we talk about diet, we talk about exercise, which is mostly, as you said, isometric, isotonic, both included, and other major component is sleep. I think without this question, we cannot also wind up this session.
Yeah, yoga is very important. I wanted to mention Surya Namaskar and yoga. Why yoga is going to gym and all will only strengthen the body. But in yoga, we take care of all the aspects of health, like physical health, mental health, emotional health, spiritual health. Thanks to Dr. Vasudha and Vivekananda Health Center, I practiced yoga in their center, and it is so helpful daily practicing yoga. So because the spiritual and emotional health is also taken care in the yoga classes. So yoga nidra helps in sleep. Yoga nidra reduces the tensions, stress levels. So it is very, very helpful. In the beginning only I told hari, worry, kari. So worry part is not taken by just walking or exercise. Whereas yoga nidra, meditation, pranayama, yoga, they all take care of worry, stress. So naturally the bad hormones comes down, the stress hormones comes down, and the level of pancreatic activity also increases, and the positive metabolism.
Very correctly said, Doctor. So just to reiterate, the last question was on sleep. So how important is sleep in this whole care of diabetes or even in prevention?
Yeah, sleep is very, very important. So good and deep sleep definitely improves the health of the person. So the hormone secretion is better. At least 7 hours of sleep, 7 to 8 hours of sleep is recommended. So early to bed and early to rise is very important. Sleep cycle and sleep patterns should be taken care.
And I think what's crucial here is you sleep as per the biological clock, because people feel I'll sleep at 1 and wake up at 8. So I'll give myself 7 hours of sleep, but that might not be helpful all the time, because I think they have to go with the circadian rhythm. That is also a crucial factor, I suppose.
Yes, a lot of research papers are there which shows that if you eat after 10 o'clock, the metabolism is in the bad state. The stress hormones are more after 10 o'clock. So a lot of research papers are there now. Insulin resistance increases if the food is taken after 10 o'clock, 10 p.m. So a lot of scientific evidence is there for all these things.
Yeah, I agree. And I think we had a lot of information given away today, and we are just, at the winding up time, we are at 7:47. So since we have so much of information now, we should allow, the people who have watched us and who will continue to watch, because this will be available on Facebook, to basically grab these ideas and then the basic pointers which have been given, especially with respect to diet, lifestyle, and sleep. And all these components together will help somebody to basically manage or prevent diabetes, because I cannot pick one or choose one. So I have to bring in all these components and therefore bring in this whole change in lifestyle. And that is how we will be able to manage diabetes as such. And I think from becoming the world capital, or Bangalore is still the capital for diabetes, as you said, we need to see that we slowly start reversing this whole figure as such, so that when we are outside India, they ask us, oh, diabetes is so much rampant in India, why? And you have to answer all those questions. So a good eye-opening session today, and especially World Health Day has been a great forum for us to have you too, Dr. Karunesh Kumar. Thank you very much for being here and sharing your valuable knowledge. And you have so much of experience of 25 years, and that makes the difference, because experience always counts and experience always talks. So we are very happy to have you once again, and thank you so much for your time. And people can also contact Dr. Karunesh at Diabetes Medical Center, or you can contact us at Vivekananda Health too. And we wish you all a great day ahead and a happy, healthy year ahead. Thank you once again, and namaste. Thank you, Doctor.
Thank you, madam. Thank you, madam. Thanks to all.